August 22, 2006. It started out as a ride to meet up with friends for coffee. It ended in a crash that left Ricardo Felizardo in a coma for 2 months with severe injuries.
No movement in my left arm, then fractured ribs with a punctured lung, the broken hip or femur.
To help him through rehab, he was prescribed medications, including oxycodone, part of a class of drugs called opioids or narcotics. Their prescription for what's called non-cancer-related chronic pain is controversial because the drugs can be highly addictive and lead to overdose.
Can you tell me how much is your pain right now?
Dr. Andrea Furlan is using a new app for doctors called the Opioid Manager, developed at Toronto Rehab.
Here you have one factor that would put you at a risk.
The app serves as a sort of checklist for doctors to help them decide when to prescribe opioids, who is at a low or high risk, and to monitor for signs of addiction.
Unfortunately, we don't get a lot of education in medical school, even in residency, how to treat chronic pain. So the guideline is not to promote more prescribing, but it's to prescribe safely and effectively.
For years, doctors believed it was rare to become addicted to opioids, but more recent data show that up to 1/3 of patients end up abusing the drugs. The new app is based on Canadian guidelines established in 2010. Guidelines, some say, are based on really thin evidence.
Is really quite weak, and it's not the sort of evidence that we usually accept when we want to make clinical decisions in medicine. So the notion that the app can be used to reliably identify patients who are at low risk or at moderate risk of becoming addicted is a misleading and probably a false notion.
Opioids do have a role for some patients, and they can be used successfully, as they were in the case of Ricardo, as he recovered from his motorcycle accident. He is no longer taking any narcotics, but he did have to go through supervised withdrawal. If you're wondering how long it takes to develop a dependence, it can be as little as 2 weeks to a few weeks on an opioid.
Unbelievable. Little did we know.
Powerful drugs.
Okay, B, thank you.
You're welcome.